When it was time for Sandy and Hirsch Fishbein to retire, they looked at places in Denver, Las Vegas, and Phoenix before deciding to make their nesting place in Greenwood Village at the Landmark.
We were really looking for a retirement community where they take you to the doctor and they take you to the hairdresser and they do all that stuff. But you also have to be kind of wealthy to get into I mean, it's ridiculous, but they want like $600,000 of, you know, income before they would even consider you. So anyway, with trial and error and going all out to Broomfield and all over the place and being interviewed and all that, we settled here because we have the movie theater, we have the walking is great around here. And so when I rewrote my list, I mean, I had this whole list of people that I never knew before that live here that I call and do things with. So we wouldn't have that in our house.
After 2 years in their new home, Sandy takes the lead in managing the household. On the master list of her household chores is to get Hirsch to his medical appointments, a task that presented some challenges.
His is sleeping and eating, and mine is cleaning, cooking, grocery shopping, planning, buying medicine, making doctor's appointments, taking care of everything. My big challenge is that the radius that I drive in is limited. And so this is a wonderful service because we usually use it for the VA appointment. And their parking is quite limited, so we might have to park and walk a distance, which my husband can't do.
After researching several senior resources, Sandy came across a senior transportation service called First Ride, and it has been her lifesaver ever since.
You call 2 days beforehand and they put you down, and then the night before you call and they tell you when they're going to pick you up and when they're going to pick you up going home. And so this picks us up at the door and drops us off at the door of the VA. If we didn't, we'd have to take a taxi for $70 up, and some, you know, it's quite expensive with taxis. And all the other names on the list did not provide that. You had to be indigent, you had to be disabled. I mean, they had all kinds of things that you had to be. This is, they'll pick you up and they'll take you.
Older American Act funds and Arapahoe County tax dollars help pay for the First Ride service, so there is no fee for riders. However, Sandy says she still makes a small donation because it's an essential service she can't live without.
The service is like a $3 donation for up and then a $3 donation for back. And it's strictly on a if you want to or you can afford to or not. And then it's funded by the Arapahoe County. So I can't say anything more than how wonderful it is. And I don't know how many people out there would need the service, but I hope it continues. And I hope Arapahoe County sees the value in it, because it is very valuable too. It's not only seniors, they take anyone who needs the ride.
There are many transportation options for older adults in the Denver metro region that enhances their ability to live more independently within their communities. A variety of organizations work to ensure that more transportation options become available to get seniors to their destinations. Let's learn about those important programs and organizations now. With me today is Linda Haley, Housing, Community Development, and Senior Resources Division Manager for Arapahoe County. Linda currently manages the Older Americans Act and state funding for seniors transportation programs for the county. She also manages the Community Services Block Grant funded Homemaker program, the Older Americans Act funded Chore Services program, and the County Veterans Service Office, as well as overseeing the housing and community development programs for Arapahoe County, which include community development block grant funds and home improvement partnership funds. Linda has more than 25 years experience with older adults. Also joining me today is Angela Shreffler, Executive Director of the Denver Regional Mobility and Access Council, affectionately known as Dr. Mac. Angela joined Dr. Mac in May 2009 after serving as the Heartland Tree Alliance Manager at Bridging the Gap in Kansas City, Missouri. Well, at Dr. Mac, Angela has grown the organization from 1 to 4 staff, tripled membership, launched several new programs, including Dr. Mac's Transportation Information and Assistance Center. Angela has experience in fundraising, working with boards of directors, marketing, program development, and strategic planning. She received her master's in public administration with an emphasis on nonprofit management and has served on numerous boards and committees. First, starting with Linda, could you please explain the purpose and goals of your organization and how they facilitate and coordinate transportation services for seniors in the region?
The goal of Arapahoe County Senior Resources is to help seniors remain independent in their own homes or apartments as they age. We subcontract with First Ride to provide senior transportation services in the urban area of the county. The funding we receive and the donations from riders allows us to provide 900 to 1,000 trips per month to destinations that include medical appointments, dialysis, grocery shopping, senior dining centers, and food banks.
Good. Angela?
Yeah, so Dr. Mac works with the community to improve access to transportation. Oftentimes when people do not have access to transportation, they feel isolated in their homes because they don't have access to support systems like doctor's appointments and social visits and other things that they need to remain healthy and in their homes. So through our membership, our members, like human services organizations and transportation providers, cities and states, different agencies that we work with, we work to coordinate transportation in the region so that more people have access to it. And we have 3 key program areas: education, coordination, and information sharing. So one of the things that I'll talk about today is our Transportation Information and Assistance Center that people can call to get any kind of transportation assistance that they need.
Can you give us a little detail on your funding?
Sure. So our funding, we actually have a wide variety of funding. Some of our funding comes from the federal government through a grant through the Federal Transit Administration. We also have local foundation support. For example, a grant through the Getting There Collaborative, which is a joint initiative of the Colorado Health Foundation and Rhodes Community Foundation. We hold a fundraising event every year where we award different organizations and individuals that are kind of leading the way in transportation coordination. And then we also work with various businesses and individuals to fund our organization.
And Linda, your funding detail?
Our funding comes from a combination of the Colorado State Funding for Seniors, which is also known as the Older Coloradans Act, Older Americans Act funds, and then in addition, Arapahoe County provides a general match fund of 10% to secure the funds and use them to serve the citizens. And
that comes from the county general fund?
Yes.
And what is the eligible age, Linda, for people to use your services?
For First Ride, you just have to be age 60 or over. The primary focus of our trips are medical appointments, dialysis, grocery shopping, senior dining centers, and food banks. And this is because with 900 to 1,000 trips a month, which is what our funding supports, we aren't able to get down into appointments like the bank, the beauty shop, and those kinds of things. There just aren't enough trips.
And the cost to an individual for using the service?
There is no cost. The Older Americans Act suggests that people who receive services have the opportunity to contribute to the cost of their services. So every bus has a donation box, and people can make a contribution if they wish to, but the contributions aren't tracked. So in terms of who does and who doesn't. Okay,
but if one of our viewers would want to send a check, you guys would take it?
They're welcome to do that, yes.
Good.
The donations help us deliver more trips.
And Angela, what about eligible age and cost to use your services from Dr. Mac?
So we don't actually provide transportation, but for our Information and Assistance Center, there's no eligibility requirements. It's open to the public. The majority of our callers, though, are older adults and people with disabilities, and we are trying to do more outreach to the veterans community and also individuals just with low income and who need transportation assistance. That phone number is 303-243-3113. One of the things that people will learn about when they do call us, though, are some of the transportation options that do exist in Arapahoe County, and I'm happy to tell more about those if you'd like.
Please do.
All right. So I think there are a lot of services in the county that people just aren't aware of. First Ride, which Linda already mentioned, is obviously one of the bigger ones for people age 60 and older, but there are a lot of other options. For example, there are some volunteer driver programs that do serve Arapahoe County. One of those is the American Cancer Society that provides trips to people who have to go to cancer treatment appointments. So while those are open to people of any age, they certainly serve older adults. There is an organization called First Transit, which provides non-emergency medical transportation for anybody who is on Medicaid. So again, it's not specifically to older adults, but it's certainly an option for people in our area. And then RTD actually operates various services within Arapahoe County as well. So for example, they have the fixed route bus system that most people know about that just goes from stop to stop that people can catch within Arapahoe County. But they also operate some other services that people may not know about. For example, there's a call-in ride in Arapahoe County that serves Greenwood Village. And the service for that it's limited, so it does operate from 5:30 in the morning to 7 o'clock at night, Monday through Friday, but it operates within a certain geographical area, so people can use that and it comes to your door and takes you to another destination as long as it's within that geographic area. So one of the nice things about that is it does connect to other RTD fixed route service. RTD also operates something called Access-a-Ride for people who aren't able to get to a bus stop. That service also, you do have to become certified for that. You have to go through a certification process to become eligible. But once you are eligible, you can take that to pretty much any destination within the RTD boundary, as long as you give them enough notice to come pick you up and take you to your ride or to your destination. So there are quite a few services within Arapahoe County and within Greenwood Village, and our Information and Assistance Center can actually help people figure out what the best option is for them.
Thank you, Angela. Linda, do you have any other programs that we might fit in here at this point?
Well, as Angela mentioned, there are the American Cancer Society does some trips, and sometimes there are other specialty organizations connected to a specific diagnosis that will do some transportation. A lot of people like to blend Access-a-Ride and First Ride, using Access-a-Ride for some trips and First Ride for others, because Access-a-Ride does charge $4.50 each way. And then there are organizations, some of the home care agencies will provide transportation at a cost if someone has the means to be able to afford to pay the hourly rate, and usually there's a mileage rate along with that. So those are private pay options that people can access. And of course, we do now have a taxi service that serves this area, and that's also available to folks who are able to pay for it.
Angela, what are the transportation challenges facing seniors in our region, particularly given the growing size of the senior cohort?
I think the biggest challenge is that as our older adult population continues to grow, the funding for those services continues to shrink. And so we're having to stretch those dollars further and further to try to provide the transportation that seniors desperately need. And so one of the things that Dr. Mack does is actually works with the transportation providers to try to stretch those dollars even thinner to provide more trips. So we work with them on different collaboration opportunities so that they can, again, have more people accessing the seats on their buses. So that's one of the ways that we try to work in the region to improve transportation. I think one of the other challenges that there are definitely some gaps in service. There's an age group, so for example, if you fall between 50 and 60, you may not have as many options as you do once you hit the 60 age range. There are also some geographic boundaries that if you live within certain areas of the county or the metro, you may not have as much transportation available to you as living in other areas. So there are definitely some challenges to transportation, but we are working really hard to try to solve some of those.
Well, given the size of the county and your tremendous responsibilities, Linda, where do you see the challenges that lie ahead?
I think Angela has identified most of them. Funding is, of course, a huge challenge. The aging population in Arapahoe County is anticipated to grow 29.5% between 2010 and 2015. And we know that the funding is not going to increase by that same amount. So we're really looking at how we can fill those gaps and looking at what people can do to help fill those gaps. For example, could a neighborhood organization that already keeps a list of teenagers who will do babysitting and things also keep a list of people who are willing to volunteer with seniors to drive someone to an appointment or shovel their walk or do any of those kinds of things? You know, HOAs can step up and try to do that. We also have a volunteer coordinator with the county, which we have made a few matches of people who can drive to someone who needs to be driven somewhere, and we will continue to work on doing that as we're able.
Thank you. Angela, is there a volunteer component to Dr. Mack?
There is. We actually, one of the things that I am excited to tell people about is a new endeavor that we have in Arapahoe County called a local coordinating council. And Linda serves on that local coordinating council, as do many other citizens in the regions, as well as representatives from organizations. But that local coordinating council is specific to Arapahoe County and is looking at how to best serve the needs of everybody in the community around transportation. Looking at some of those volunteer programs that Linda just mentioned, looking at how they can maybe take some of the ideas that are being implemented from other parts of the metro and make those happen here in Arapahoe County. So that Arapahoe County Local Coordinating Council is run by Dr. Mack, and we'd be happy to share that information with people and to get them to join that. We do meet monthly, and there's a good mix of, again, organizational representatives as well as just interested citizens who are at the table who want to be able to help around transportation.
Angela, since you have a national perspective in that you came from Kansas City, Missouri, how does the Denver area rank nationally in terms of taking care of its senior transportation needs?
Well, I actually didn't join the transportation industry until I moved to Denver, but I can tell you, having traveled quite a bit, that our bus system is actually really one of the best in the country, especially when it comes to accessibility. Another project that Dr. Mack has is a Transit and Accessibility Task Force, which has representatives from RTD, both staff and board members, who really look at how we can remove some of the barriers to the fixed route system so that more people can ride the bus. I think it's a great task force. One of the things that we're getting ready to launch is different mobility audits, so looking at what barriers stand in the way to people accessing the bus stop. And we'll certainly be coming to Arapahoe County when we start doing those mobility audits. But I think we're actually really lucky to have a transportation provider like RTD in the region that does so much for our region.
Linda, if you could share with us, since you have a panoply of various things that you do for seniors, where people could find more detailed information?
People can go to the Arapahoe County website, which is www.arapahoegov.com, or they can call First Ride to register for transportation, and that number is 720-540-5566. And people are always welcome to call my office, and I will chat with them about whatever senior needs that they might have, and I can be reached at 303-738-8089.
Well, thank you for putting your phone number out there. And Angela, you earlier spoke to a phone number. Are there any other resources that you could share with our viewers?
There are. One of the things that Dr. Mack has done the longest is actually published a Getting There guide that lists all the different transportation options in the metro. We give out about 25,000 of these a year. They're available in both English and in Spanish. And we also have them as audio files. So for people with visual impairments or who are blind, they can access the information as an audio file. So people can request copies of these through the number that I gave out, 303-243-3113. And through that number, you can also have live access to a transportation resources specialist who will answer any questions about transportation, whether it's helping someone find a different transportation provider or explore some of the options that they have, or even serving as an advocate to some of the providers. Maybe it's helping them fill out an application, whatever they need to get access to transportation.
Well, today, ladies and gentlemen, and of our viewing public, we've been privileged to have two people to talk about transportation who really know the details and how to help, and who have been extremely open and helpful in sharing this knowledge with us and with you in the future with the numbers they've given. So don't hesitate to use this resource for transportation issues for seniors. So far on the Mayor's Show, we have learned about some important quality of life topics that impact seniors every day. Although some of these topics may be challenging to address, this last topic will probably be the most difficult. Making the decision to sell your home and retire to an assisted living community or move a loved one to a long-term care facility is never easy. Finding the right facility is even tougher.